Hello, greetings, and welcome again to another segment of Casa Cares. My name is James Washington. I'm one of the staff members here at Richland County Casa. Today, I'm very excited to have some guests who are going to share what the outstanding program is about. Without any further ado, our guests for today.
Hi, my name is Michael Lambright. I am the State Director of Clinical Intake and Day Treatment Services for Community Resource Solutions. I am a part of the executive management team where we have our CEO, Dr. Stewart, and our COO, Ms. Jones, Ms. Tanel Jones. And we have our Chief of Clinical Services, who is Mrs. Stewart. And then we have Mr. Tim Gould, who is our Chief of Compliance Officer for Community Resource Solutions, and that makes up our executive management team. And I come here at CRS just came with February of 2013. So I'm fairly new with Community Resource Solutions. I moved here in the area from New York about a year and some 6 months ago, and I've have had the opportunity of being with Community Resource Solutions. Had several positions with the agency since I've started in February, and I'm grateful that they have seen the experience that I bring to the table and have propelled me into this position that I have at this present time in a small period of time. So that's one of the reasons why I'm here representing the agency in this capacity to inform you in terms of the services that we have and help get the information out for the services that we provide for our children and our families. And I have here with me actually Mrs. Morrison, who is one of our outreach workers in the area. And I know that they wanted to have me say a little bit about the fact that maybe just a little bit about the biography. I'm a licensed master social worker, and I did my master's at Yeshiva University in New York. And all of my career experience in working in mental health has been over 20 years, and it all has been in the city. And so I think a part of that, with me now being in the South, it brings a whole wealth of different knowledge and information from the North to the South that will help to be able to increase the efficacy of our program developments and just how we do business day to day. So I'm really happy to be a part of this. And so, as I said, I do have with me Ms. Morrison, who is one of our outreach workers in this area. And I would like Ms. Morrison to kind of just introduce herself to you.
Hello, everyone. Thank you, Mr. Lambert. My name is Yvette Morrison. I am the outreach coordinator for Community Resource Solutions. A little bit about myself. I came from Chicago back in 2000 into the North Carolina area. My role at CRS as the outreach coordinator, I identified the need for mental health services in the Columbia area, in the Rock Hill area, and also in the Greenville area. I have a passion for letting the community know that the mental health services are available to them. So I'm in the community, whether it's in school, whether it's at the workplace, whether it's at walking down the street or on the bus, in a car, whatever. I want to make sure that the public knows that the services are available and they can get the help that they need. Here at Community Resource Solutions, our mission is that we believe that every person diagnosed with a mental health illness can effectively manage their own lives if given the appropriate community resources. It's our mission to collaborate with local community providers to develop and provide effective prevention services and programs while delivering comprehensive, compassionate, and consistent quality care to those affected by mental health diagnosis.
And with that being said, Ms. Morrison, one of the things in terms of our goals is, kind of like in a nutshell, what we try to do is we want to increase functionality and decrease dysfunctions. And sort of like what that means is that, we have our beneficiaries that come to us because a lot of times the children are experiencing behavioral issues. They're experiencing complications in school, in the community, in the family. and then it disrupts the whole family unit. It disrupts the nuclear family, and it disrupts the extended family, and then it kind of spills out into the environment, into the community, and it disrupts the community in some form or fashion. And so, with that being said, in terms of looking at increasing functionality, is not just the individual. We look at the individual, we look at their family, we look at the community, and how all of those interrelate. And so we can kind of call it like socialization, because they are taught socialization skills as well. And so, we kind of have the gamut of a whole the person-centered approach. So we look at the whole person, the ecological approach, looking at the environment that may affect certain things in that person's lives and their behavior. And we kind of try to bring all that together and address each one of those components to make a comprehensive intervention strategic plan of action. Now, one of the things I would like for you to kind of maybe help our viewers understand a little bit about, how do we accomplish that by some of the things that we do promise that goes along with our mission and our goals.
Okay. Well, Mr. Lambert, we promise that we will provide intensive long-term support to initiate and maintain major behavioral changes as it relates to our clients' mental health status.
Mm-hmm.
And also, we will spend time developing trust and open communication with all the clients despite their illness. We will provide comprehensive case management services that adhere to the standards of CARF, and our funding source as our consumers' health status, it fluctuates along the wellness-illness continuums. We will maintain our clients' confidentiality, which providing a positive and strong presence in the community. We will employ the person-centered process in the development of individual care plans. And also, we will allow the client the freedom of choice in the delivery of care and service coordinations.
And that's interesting in terms of how these things correlate. Because one of the things I believe that we pride ourselves on as an organization is that person-centered approach and each client's right to self-determination, which is a part of the ethical standards and social work practice. And I think that one of the things that we do want to make sure is that people are involved in their own treatment plans. Because it's actually their plan, it's their life. The goals are theirs, and we just assist them with helping develop the goals that they want to work on and what do they want to see change. And I think that's one of the things that may separate us from other organizations in terms of our approach, because it's very person-centered approach. And a part of that person-centered approach, like I said, is a part of right to self-determination. And it's also a part of a strength perspective. And so we're not just looking at just an ailment. We're not just looking at a diagnosis, but we're also looking at a person's strength, because I believe in best practices. If we can find the strength, that strength can help them get better in terms of their dysfunction or their behavior impediments or the barriers to them functioning in the way that they want to function in a successful manner. And so I think that's one of the things that separates us, because we really do look at that strength perspective. We really look at the person-centered. We always are reminded that it's always about these kids. It's always about the family. It's never about the staff. It's never about the worker. It's always about the kids. And if we keep that, I think that's important, because sometimes we lose focus, because this work is hard. By no means is it easy. You're dealing with people's lives. You're dealing with people who are having difficulties, and they're looking for someone else to be able to assist them through it. And you're coming into someone's life. It's almost like joining the family, so to speak, professionally and clinically, not really joining the family, but joining the family in terms of meeting them where they are and looking at where they're starting from, where they're struggling with, and then kind of meeting them there, and then finding out where do they want to go. And then we assist them with helping them meet those goals and objectives that they have outlined for their lives, because at the end of the day, it's their life.
Also, my role here as the outreach coordinator, I see the potential consumer firsthand. I identify the need for the mental health services in the community. Some of the services that is offered from Community Resource Solutions is behavioral health assessments. Each individual will have an assessment based on their challenging needs for behavioral health. Community support, we support the community in all markets. For individual and also those services. Any crisis intervention services, whatever the crisis may be, we have those services for that any diagnostic assessments, each individual, as I said earlier, has a diagnostic assessment. Family outpatient services, we work with the whole entire family. The need for the mental health services. We do a group outpatient services also. Individual counseling, there's a need for a one-on-one. Some potential consumers don't want to be in a group setting. They just need the one-on-one, depending on the variance of their need. Treatment plan. Each potential consumer has a treatment plan development to the goals that of their needs. Any court order services such as psychological evaluation. We work with people that has anger management, parenting classes for parents. Also, any substance abuse intensive outpatient services that we do offer. Food banking services. There may be a need for food in the household. We do have resource services for that, and also our day treatment for adolescents. Those are some of the services that CRS offers the community.
And Ms. Morrison, along with that, you ended up saying about the day treatment services for the adolescents. There's also day treatment services for the kids. They are between the ages of, but we start at 5 per se. We start at 5, but 5 years old and up is a part of the population at our day treatment, and our day treatment is called Aspire. And to tell you a little bit about what day treatment services, and a lot of people may or may not understand the level of care for day treatment services, and sometimes I think that it's important to make known the difference between day treatment and day care. Day treatment aspires a day treatment service, and it's a therapeutic intervention that's being provided in the program. So it's not babysitting kids. It is actually a therapeutic modality that we're using to address more severe behavioral issues. Basically, Aspire's day treatment services are designed to be an alternative to residential treatment. Once we have a child that comes through and they have been assessed, and the assessment and scored the CalOCUS, which is required by Medicaid to look at the level of service. Depending on that score, sometimes that score is high enough that that child would normally be eligible to go to a rehabilitative, like inpatient treatment facility, residential treatment. And so when we look at that, Aspire is the alternative to having to go to a residential treatment. So I think the way that the field is moving is where we're trying to find alternatives to just pretty much institutionalizing children. Historically, that's what mental health basically primarily came from, and many people may know that whole institutionalization where you just took people that had mental health issues and you just threw them in a building somewhere like a warehouse and just locked the door and just let them run free and do whatever until they actually transition out of this life, and so I think that the goal is not to go back to re-institutionalizing kids, especially kids nowadays, because we're finding so much more behavioral issues manifesting themselves in our children. But it's not to institutionalize them. So we're looking at as a best practice to have day treatment, so that it's a higher level of care, but it's also provided in the community, so the child gets to stay home. But they come to the day treatment. Rather that's in the summer we're operate from 9 to 3. So it's a little bit. The model would be called extended day treatment from my research during the summer. And then during the school term, it operates, I believe it's from 3 o'clock or after school, when school is out, like 3:30. And I think it goes to like 7 o'clock. So it's a little less intensive in terms of the hours, but it's still the same services that's being provided, just in a shorter period of time. And I think I should say a little bit maybe about that, because so that people are kind of clear in terms of, well, what does day treatment aspire? What does it do? It's not where kids just come and we play ring around the roses and jump ropes and you get a snack and go home. It's not that. We just going to help you with your homework like it's tutoring services. That's not the clinical approach to what we do with these behavioral issues. So some of the things that actually happens, and I can kind of elaborate just a little bit on each of those services just to get a little nutshell about what they may be. So one of the things that happen it's not just in the day treatment, but it's a part of what we do as providing rehabilitative behavioral health services in general. Pardon me, because some of these services are actually provided like what we call in the community. So it's in that person's home. And it's the same type of services that they may be getting in day treatment, but they don't need that level of intensity. So it's being provided in the home. And that's a part of the new wave of best practices, where it's posited that children and families can probably benefit better from interventions that are provided in their own environment where they're comfortable. And so you tend to see the change happen a little bit better or more effectively, I should say, because they're in their own environment, as opposed to having to go and just come to an office and sit there and talk for an hour or whatever, and then that's it. It's a little bit non-traditional in that approach. This is how we kind of do the person-centered, and then we also keep the family involved as well, because typically what happens is that we will have we provide behavior modification, and pretty much behavior modification is we want to reduce the unwanted behaviors and increase wanted behaviors, to kind of put it in the vernacular. And that's just pretty much, there's a technique to be modification. There's a lot of teaching skills and modeling those behaviors, and giving, alternative ways to express anger or frustration, because a lot of our kids have a lot of frustration, intolerance, and emotional dysregulation. And so it's the B modification is to help kind of change the behavior, and you want better behavior. So I'll put it in that vernacular. And then there's PRS, which is kind of like psychosocial rehabilitation services. That approach is a little bit more about helping a person become independent with the knowledge of the disorder or the knowledge of the particular disease or the diagnosis, and helping them to figure out, or assisting them with skills that they can develop to help manage the symptoms of the particular diagnosis. So that's kind of like what PRS is, and it's designed to kind of help a person, like I said, kind of be independent. It's ADL skills, just things along that nature. But it's definitely client-centered, focused approach. And then along with that, then there's of course, then there's FS, which is called family services. And the family services, if I could use one word to explain this family services, I would call it psychoeducation, because basically what we're really doing is really, really educating the caretaker, the parent, whomever is the caretaker or caregiver. We're really educating them on the child's diagnosis and how to kind of like provide the interventions, and educating them on how to actually deal with the certain behaviors, even for them, because the parents or the caretakers has to be well themselves in order to help the child. And so we don't leave them out. And unfortunately, a lot of parents, it has been my experience, sometimes the level of frustration is just, here, you take my child and please fix them and then bring them back when you're done, because they're frustrated. And I get it. I understand it. And I think that's where family support comes in, where we help them to understand the nature of the behavior that's being manifested, and kind of supporting them through it and helping them understand how to help change the behaviors. Because it is a science. It's proven, I would say, that without the family involvement, it's more difficult for the child's behavior to change. And so we also want the parent involved, the caretaker, in the treatment, because we kind of think that as best practice, that kind of works to have the parents involved, and it also shows the child the support. So those are some of the services that we provide in terms of how we our intervention, that we provide our intervention, so that is holistic. And then, of course, there's individual therapy, and then there's family therapy. Those are the classic ones that everyone probably knows about, that people are afraid of, because when you hear individual therapy, people say, I am not crazy. There's nothing wrong with me. What do you mean? I'm not sick. But we've come a long way. It's not about being sick. It's just about having someone objective to help you kind of figure things out on your own. And that's how I deduce therapy. In my professional experience, that's what I call it. I'm just here to assist you figure things out for yourself. How about that? And then it doesn't make you sound crazy. So I hope that the presentation that we have given you have been very helpful and informative. If you are ever interested in our services and feel that you even just want to see if there's a need for services, I will suggest that when you go to your family doctor or your pediatrician, that you ask them, um, discuss with your doctor first your concerns, and it would be great for your doctor to go ahead and make a referral to us at CR Community Resource Solutions, which is an easy way to kind of do it, because we want to be connected with the doctor so that we have conversation in terms of the treatment planning. And what the doctor sees and what we've assessed, and so on and so forth. So that would be one of a great way for you to get in contact with us is through your family doctor, your pediatrician, for the referral. You can also visit our website, which you will probably see up on the screen, and you can also keep an eye out for one of our great outreach workers like Miss Morrison here that you just may happen to see. Now that you see her face, if you see her, you can go run her down and say, "I want that service," and you can do it that way too. Or if you're interested in becoming a part of CRS team, please visit our website. And you will get more than enough adequate information on our website. And I think I would like to leave you in saying that if we can sum up everything that we have said about the services that we provide, and um, our feelings about our person-centered approach, I would say that we are looking at being the best provider for mental health and behavioral services in the Southeast. That is our CEO's goal. And if you don't remember anything else about what we are about, if you can just remember that changing lives is the nature of our business.